Right now, more than 9 out of 10 adults over the age of 50 have visible dark patches on their face, hands, or chest. Most have reached for creams. Most have experimented with home remedies. Most have even brought it up with their doctor and received the same 4-word response. It is just aging. That answer is not only incomplete, it is misleading. I am going to explain exactly why. And more importantly, I am going to walk you through what your skin is actually trying to communicate. Because age spots are not a final verdict. They are not an unavoidable consequence of growing older. They are a signal, a very specific signal, that internal processes inside your body have shifted out of balance. And those processes can be corrected without expensive procedures, without $100 serums, without surgical intervention, using resources that are already sitting in your kitchen and embedded in your daily routine. If you have spent money on brightening treatments, chemical peels, laser sessions, or over-the-counter fading creams, and those spots have barely changed, there is a clear reason for that. You are repainting the walls of a room where a pipe has already burst. Until that pipe is repaired, no amount of fresh paint will hold. This channel exists for one reason. The system profits when you remain unwell, not when you fully recover. What I am about to share is not something you will hear explained in detail in a dermatology waiting room. There is no billing code for walking patients through the 5 root causes I am about to outline. Deep inside the lower layers of your skin live specialized cells known as melanocytes. Their single function is to produce melanin, the pigment responsible for your skin's color. When you are young, melanocytes distribute pigment evenly across the skin. The tone appears smooth, balanced, and consistent. But under certain internal conditions, these cells begin to behave unpredictably. Some slow down dramatically, others become overactive, releasing excess pigment into one concentrated area. The result is a dark patch surrounded by lighter skin. The key concept to understand is this: age itself does not damage melanocytes. What disrupts them are specific physiological imbalances. The sun is only the trigger. But for any trigger to create a reaction, there must already be fuel present. That fuel is what is happening inside your body. When internal systems function properly, sunlight is not your enemy. When internal balance is lost, pigmentation can deepen even in winter, even on cloudy days, even with minimal UV exposure. This is why people apply sunscreen consistently and still notice their spots getting darker. Because number one, the organ almost no one associates with skin health, your liver. You may be wondering what the liver has to do with pigmentation. Your liver performs over 500 functions simultaneously. It filters blood, processes fats, neutralizes toxins, and carries out a role that is rarely discussed in dermatology. It directly influences the condition of your skin. Every day, substances enter your body through food, water, and air. The liver processes them and prepares them for elimination. But when the liver becomes overloaded, the burden shifts to backup systems. One of those systems is your skin. This is not symbolic. It is biological reality. Your skin is not just a protective layer. It is an active excretory organ. When partially processed compounds circulate through skin tissue, they irritate melanocytes. Irritated melanocytes lose precision. Pigment is released unevenly, often accumulating in thinner areas like the face, hands, neck, and chest. This is why expensive creams often fail to create lasting results. As you age, blood flow through the liver naturally declines. By the age of 75, it may decrease by up to 30%. The liver works harder, but performs less efficiently. However, the liver has a remarkable ability to recover. Remove stressors, provide supportive inputs, and its function can improve within weeks. 3 simple tools can support this process. First, begin each morning with a glass of warm water and a slice of lemon. The temperature should be close to body temperature. This gently stimulates bile flow, which tends to thicken overnight. If you have high stomach sensitivity, replace lemon with half a teaspoon of honey. Second, incorporate bitter foods. Dandelion root is one of the most accessible options. 2 tablespoons steeped in hot water for 20 minutes creates a simple tea. Drink half a cup before your main meal. Third, eliminate trans fats entirely. These are found in margarine, processed baked goods, and many packaged foods. Check labels carefully. If you see partially hydrogenated oils, avoid it. Replace with natural fats like butter in small amounts. 3 actions: warm lemon water, dandelion tea, and no trans fats. Within weeks, liver stress reduces and skin burden decreases. Not theory, physiology. Cause number 2, the factor that influences pigmentation just as strongly, yet is rarely discussed in this context: your gut. Scientists now refer to this as the gut-skin axis, a measurable connection between intestinal health and skin condition. Your gut is not just a digestive tube, it is a complex ecosystem containing trillions of microorganisms. These bacteria synthesize vitamins, regulate immune responses, and control inflammation across the entire body. When beneficial bacteria dominate, they maintain a strong intestinal barrier. But when harmful strains take over, that barrier weakens, a condition commonly known as leaky gut. Through this weakened lining, bacterial fragments and toxins enter the bloodstream, triggering a low-grade inflammatory response throughout the body. This inflammation is often silent. No fever, no immediate pain. But it is powerful enough to disrupt melanocyte behavior. Remember the concept of fuel. This chronic inflammation is exactly that. Even in the absence of sun exposure, pigmentation can intensify if this internal process continues unchecked. Expensive probiotic capsules are not necessary. What your body needs is real fermented food. Start with traditionally fermented cabbage, also known as sauerkraut, made only with salt and cabbage, not vinegar. 2 to 3 tablespoons daily is sufficient. Next, kefir. Choose plain kefir with a short shelf life, ideally no more than 7 days, as this indicates a higher concentration of live bacteria. Drink 1 glass before bed when the gut performs its most active repair processes. These beneficial bacteria also require nourishment. Their primary fuel is fiber. One of the simplest sources is real oatmeal, not instant varieties. Cooked slowly, 3 tablespoons in the morning, provides the necessary support. Movement is equally essential. Walking after meals stimulates digestion and restores natural intestinal motion. Additionally, a gentle clockwise abdominal massage before bed, about 30 slow circles, can further support gut activity. Cause number 3, the factor most people assume is the primary cause: the sun. In reality, the sun is not the root cause, but a trigger. When ultraviolet light reaches your skin, it signals melanocytes to produce melanin as protection. This is a normal, healthy response. However, when internal inflammation already exists, that response becomes exaggerated. Instead of evenly distributed pigment, concentrated patches form. This is what you see as age spots. Sunscreen alone cannot solve this. Your body also needs internal protection. Certain foods strengthen the skin's resilience against UV damage. First, carrots. They are rich in beta-carotene, which accumulates in the skin and acts as a natural filter. However, beta-carotene is fat-soluble. Without dietary fat, it is not absorbed. Always consume carrots with a source of fat such as butter or oil. Second, tomatoes, particularly cooked tomatoes or tomato paste. Heating releases lycopene, a potent antioxidant that protects skin cells from oxidative damage. 2 tablespoons daily is effective. Third, green tea. Loose leaf is preferred over bagged versions due to higher concentrations of active compounds known as catechins. 3 to 4 cups per day provide significant antioxidant support. Together, these foods enhance your skin's natural defense system from within. Practical guidance remains simple. During peak sunlight hours, seek shade, wear light protective clothing, and avoid prolonged exposure. But do not eliminate sunlight entirely. Your body requires it for essential processes. Cause number 4, one that affects the majority of older adults, yet is often overlooked: Vitamin D deficiency. Your body produces vitamin D through sunlight exposure. As people age, they tend to spend less time outdoors, leading to widespread deficiency. Vitamin D plays a crucial role in immune regulation, skin cell renewal, and inflammation control. It also directly influences melanocyte activity. Maintaining adequate levels is essential for skin health. Supplements are not always required. Begin with natural sunlight. Around 15 minutes per day, with arms and face exposed, is typically sufficient during warmer months. In addition, include dietary sources. Herring is one of the richest natural sources. A 100-gram serving can exceed daily requirements. Egg yolks also contribute significantly, with 2 yolks providing a meaningful portion of daily needs. Cod liver, consumed in small amounts such as 1 teaspoon daily, is another effective option. These are simple, accessible foods that support a critical function. Cause number 5, the factor that can override all others: chronic stress. This has nothing to do with diet or sunlight, yet it plays a central role. Long-term stress keeps the body in a constant state of alert. The brain signals the adrenal glands to release stress hormones repeatedly. While this response is useful in short bursts, chronic activation creates widespread imbalance. Stress increases inflammation, stimulates excess pigment production, and weakens the skin's protective barrier. Even with perfect nutrition, ongoing stress can prevent improvement. A simple technique can help regulate this response. Sit comfortably, close your eyes, and place one hand on your chest and the other on your abdomen. Inhale slowly through your nose for 4 seconds. Hold for 7 seconds. Exhale through your mouth for 8 seconds. Repeat this cycle 4 times. This activates the parasympathetic nervous system, reduces heart rate, and lowers stress hormone levels. Practicing this daily, especially before sleep, improves both recovery and skin repair. Deep sleep is when the skin undergoes its most active renewal process. 5 causes: liver overload, gut imbalance, sun exposure, vitamin D deficiency, and chronic stress. All increase with age, but all can be addressed. Now for the practical application. Can external treatments be used alongside internal correction? Yes, but they must support, not replace, internal work. Before applying anything to your skin, understand this. A damaged skin barrier will react negatively even to beneficial ingredients. For 3 days before applying any mask, stop using soap entirely. Use only warm water. This allows the barrier to rebuild. Once restored, a simple 3-ingredient mask can be used. Kefir provides mild lactic acid. Honey hydrates and protects. Turmeric reduces inflammation. Mix 1 tablespoon of kefir, half a teaspoon of honey, and a very small pinch of turmeric. Apply to the skin. Leave for 15 minutes, then rinse with warm water. Use 3 times per week in the evening only. Morning application increases sun sensitivity. Another essential component is lymphatic movement. The lymphatic system removes waste from tissues but has no pump. It relies entirely on movement. A short daily routine is sufficient. Light bouncing on your heels, seated heel pulses, a full body stretch, and gentle facial tapping, followed by outward strokes toward the ears, all support lymph flow. Consistency matters more than intensity. Now let's bring everything together into a clear, structured plan you can actually follow. Week 1 is preparation. Each morning begins with warm water and lemon before eating anything. Each evening, 1 glass of kefir about an hour before bed. Remove all trans fats completely. Start dandelion root tea before your main meal. Stop using soap on your face and allow the skin barrier to recover. At this stage, you may not see visible changes yet, but internally, the system is already shifting. Week 2 is activation. Now the full protocol comes into place. Breakfast includes oatmeal with grated carrot and a small amount of butter to ensure proper absorption of nutrients. Green tea becomes a daily habit. Meals include natural, unprocessed foods, and fermented cabbage is added regularly. Protein sources such as eggs and fish are introduced consistently. Movement becomes part of your routine, along with the evening breathing practice. At this point, your body is no longer reacting randomly. It is beginning to regulate itself. Week 3 is observation. This is where you start paying close attention. Look at the edges of the spots. They often begin to soften. The color may start to lift slightly. Skin tone may appear more even overall. Add tomato paste into your meals daily to increase antioxidant support. Continue everything else without interruption. Week 4 and beyond is consolidation. This is where consistency becomes your advantage. Over the course of 2 to 3 months, noticeable improvements can occur, not only in pigmentation but also in overall skin quality, firmness, and hydration. Sleep improves, energy stabilizes. Because you are no longer treating a surface issue, you are supporting the entire system that created it. There is also a simple additional technique you can include. Temperature contrast. Place a metal spoon in the freezer for a few minutes. Rub your hands together to create warmth. Then press your palms gently against your face for about 10 seconds. After that, apply the back of the cold spoon briefly to areas of pigmentation. Finish again with warm palms. This alternation encourages circulation and supports lymphatic movement. It takes less than a minute but reinforces everything else you are doing. Take a photograph of your skin today, then take another in 2 weeks under the same lighting conditions. Small changes become much easier to recognize when you compare directly. Now step back and look at the full picture. Pigmentation is not random. It is influenced by 5 core factors: liver function, gut health, sun interaction, vitamin D levels, and stress. When these are addressed together, results follow naturally. Warm lemon water and bitter herbs support the liver. Fermented foods and fiber restore gut balance. Antioxidant-rich foods strengthen your skin's resistance to environmental damage. Sunlight in the right amount supports vitamin D production, and controlled breathing reduces the stress response that silently drives inflammation. These are not isolated actions. They function as one connected system. There is one important clinical note that should always be kept in mind. If any spot changes shape, develops irregular borders, becomes significantly darker, or looks different from others, it should be evaluated by a qualified professional. Supporting your body naturally does not replace medical assessment when something unusual appears. Now here is your 5-step action plan to begin immediately. Step 1. Stop using soap on your face for the next 3 days. Allow the natural barrier to repair itself. Step 2. Tomorrow morning, begin with a glass of warm water and lemon before your first meal. Step 3. Remove all sources of trans fats from your kitchen right now. Read labels and eliminate anything containing partially hydrogenated oils. Step 4. Introduce kefir into your nightly routine this week, 1 glass before bed consistently. Step 5. Begin the 4 to 7 to 8 breathing technique tonight. 4 seconds inhale, 7 seconds hold, 8 seconds exhale, repeated 4 times. 2 minutes total every evening. These 5 steps require no expensive products, no appointments, and no complicated systems. Just consistency. The reality is simple. No one is going to walk you through this in detail during a short appointment. Not because it lacks value, but because there is no structure in place that prioritizes long-term resolution over ongoing treatment. This is not about blame. It is about understanding how the system works and taking responsibility for your own outcomes. If you apply what you have learned here with consistency, your skin will respond, not overnight, but steadily and measurably. And not just your skin. Your overall well-being will improve alongside it. Please subscribe to Dr. Nathan Hayes and hit the like button. Thank you for watching, and I will see you in the next video.